patients in Murang'a no longer carry a physical card. They just walk in with their ID. The data is fed into the computer. Then they can, if they so wish, they can print it, but it's also stored in a manner they can access it digitally later on. And therefore, that helps in terms of mobility of data. So that if you go, let's say you're a Murang'a patient, you go to Nairobi to seek further medical care, you just enter into our health portal, retrieve your data even outside Murang'a. That also secures patients' data for eternity, because if you get medical card, it can get lost. You can store it and it is misplaced. The other issue is if you get an accident, for instance, you are brought unconscious before a doctor in Murang'a, you may not be able to explain to the doctor your prior condition because you can't speak. So there's every likelihood the doctor will do an intervention without him knowing your history. Maybe you are anemic or whatever. So you will practically die because the doctor will be doing guesswork. But now that the information is already there, if you have been coming previously to a Murang'a medical facility, so you get better treatment because the doctor has your prior data when you are being treated.
Your county, Makueni, has embraced prompt solution, and from your perspective, what has been the most significant impact of prompts on maternal health outcomes and citizen engagement in the county? And you can also tell us what key factors contributed to its effectiveness.
Prompts has been a partner in Makueni, and there have been very many positive outcomes of the utilization of prompts in Makueni County. One of the outcomes is that we have over 20% increase in prenatal visits by mothers who are expectant, and that means if they are able to go at least 4 times before they deliver their babies, and that means better health outcomes. And this is because of the SMS system, which has been previously presented here, and we think also that's also a very good interaction between the mothers to be new mothers with the health system.
We must work with national and county government. I think we've mentioned, our platform is AI enabled. Now, does that mean we started using AI a lot? Of course, even before other organizations were using it. But we're also working very closely with the different policymakers to ensure that we're aligned and that we're focusing on the national and county strategies, because we are not in the business of creating innovations or solutions for ourselves. It's actually for Kenya. We are not here to say, oh, it's about prompts. It's actually about the mothers. When moms join prompts, they get a welcome message from the county, not from Jacaranda Health. So we must build and we must innovate and we must make sure that we're working with national and county governments, because that's the only way we will be successful.
Back 2021, yes, I was already working as a nurse and a midwife. So the Jacaranda team came to roll out the platform, the prompts platform, that I was now among the implementers. And then coincidentally, I was also expectant at that time. So I was like, why not also try this platform and have an interaction with it as much as I'm a healthcare worker, so that I also have an insight on it. So on the support on pregnancy, so this platform actually, because I've followed it from my entire pregnancy, postnatally, and even another pregnancy that I had, and even postnatally. So during pregnancy, I received several messages concerning pregnancy, from danger signs, on hygiene, on nutrition. Like, there are so varied messages on exercise, as well as you can also ask questions and get feedback.
We'd just like to know, how does the Ministry of ICT and the digital economy collaborate with the Ministry of Health and with the county governments to ensure that digital health solutions are not only technologically robust, but also integrated seamlessly into existing health systems for maximum impact?
The concern you have in Muranga is actually the concern in many parts of the country, because now we find the demand for broadband is increasing, reliable and effective connectivity. The private sector has also made quite some effort. By end of 2022, we had only 1.2 fixed broadband connections on fiber the whole country. That includes homes and businesses. As of now, we are around 1.8, approaching 2 million. We have Kenya Power already connecting towards 9.5 or almost 10 million homes connected with power. So there is quite a lot of work we need to do when it comes to fiber connectivity. And for that reason, we changed the model of connecting so that we can leverage the over 300,000 kilometers of national power grid, so that we can achieve that connectivity. So we've identified 74,000 public institutions across the country that needs to have broadband connectivity, and it will also support the private sector, including Safaricom and all the other that provide also services to the citizens and businesses.
Engineer Kipchumba, from your perspective, what are the most significant opportunities and challenges in leveraging emerging technologies, especially such as AI, to strengthen Kenya's health sector and accelerate the achievement of universal health?
Emerging technologies, including AI, will really improve the quality of service in the healthcare sector. One, it will fast track diagnosis. You've had one of the biggest issues, even the PS talked about, is wrong diagnostic or slow diagnostic. Adopting these emerging technologies and AI, you can accelerate that process. The second one is also empower the service providers. AI, just like any other tool, has huge value. First, it empowers you. You don't need to remember the basics. The AI tool can actually help you to you don't make obvious mistakes. So giving this platform across the healthcare service providers, it will improve the quality of service across government.
We learn a lot from Muranga. Governor Muranga, Your Excellency, we learn a lot from you as a Makueni County, and we continue to get lessons from you because you're really trailblazing. And very soon we shall be launching Makueni Mutulake, just having been able to learn from you.
I think we've asked about scale and getting our story out there, and the question was, what's our strategy to get to niche counties and national? I don't like to be negative, but I'm going to start on a negative note. We have gone county by county to get to the 24 counties. We cannot do that anymore. There's no money to do that anymore, to get to 47 counties. And let me be honest, we're struggling to fundraise for us to get to the 47 counties. So I want to ask our panelists at government, how can we, not necessarily just cost share, but how can we go together to get reduced zero rating, for example, for SMSs? We're spending 70 million shillings a year on SMSs for months. When we go to Safaricom, I'm just Miss Cynthia Kaumbura, Jacaranda Health. But if I go with everybody here on this panel, we can get the zero rating.
For our country, universal healthcare has been a vision, a dream for decades. We are at the point that we are seeing it becoming a reality. And we are very happy that the design that brought in the existing system today of Digital Health Authority, or the platform that is driving the universal healthcare, really looked at all the other aspects and integration to other solutions that can be provided by partners. It has addressed the issue of ensuring the power of the citizen. The citizen can own their data. They are the one to authorize their data to be used by any third party. We've also ensured that the citizen can move anywhere with their data. That is the design concept of the digital health solution.
Opportunities that will now arise going forward, will now be using the system to see who is the most productive employee, and therefore assign benefits based on productivity, not on patronage, how you know the boss. We are not there yet, but I think we are somewhere because of automation. Thank you.
Thank you so much. I'd like to thank our panelists. And today, I think what we've learned and what we've had is that technology is a powerful enabler, but only when combined with policy, infrastructure, and trust, of course. From counties like Murang'a and Makueni to national strategies, from ICT infrastructure to community health innovations, the path to universal health coverage will require all of us.